metabolic syndrome is such an easy condition. I wouldn't say disease process, but a condition that can be resolved to optimize your health. Hey everyone, I am going to be discussing metabolic syndrome, and for those of you who are watching this video for the first time or watching me for the first time, I am Dr. Chellam and I am an internist. My website, if you want to go to learn a little more about my practice, is Holistic and Integrative Center of Novi or holisticicon.com. So I'm going to start a small series to help people delve into prediabetes, metabolic syndrome, weight issues, and diabetes. And why am I doing that? Because what I have realized is people come to me for different reasons, right? They come to me for fatigue. They come to me for fatigue that hasn't resolved over a period of time. They've gone through every testing possible and they're certain something is wrong. And then when they work with us, everything gets better, but something very unique happens in their blood tests. Most of them come to me with insulin resistance, and that completely resolves. So over the years, I've noticed that metabolic syndrome is such an easy condition. I wouldn't say disease process, but a condition that can be resolved to optimize your health. So what is a syndrome? Syndrome is a collection of conditions which occur in a pattern and gives you a certain disease process. So metabolic is everything about the metabolism. So there are several studies that contribute to what is metabolic syndrome. So there are, like, the Endocrine Association is different from a few other studies, but here are the few things that they look at to understand what metabolic syndrome is. For you as a patient to understand metabolic syndrome, if you've been struggling with weight gain issues, if you've been struggling with where your doctor says, oh, your blood sugars are a little high and not yet a diabetic, and you've been running around like that for 10 years and nothing seems to shift, it doesn't go down no matter what you eat and exercise, it doesn't get worse, but you're called a pre-diabetic, this is what you want to listen to. And then if you're one of those who's had high blood pressure, risk for heart disease because your cholesterol, your triglycerides are high, this is what you want to listen to. Okay, so there are a few things that they take into account for metabolic syndrome. You guys ready? Number one, which I think is very obvious, is increased waist size or measurement. Number two is increased triglycerides. Number three is increased blood pressure. Number four is increased blood sugars, right? Blood sugars can be measured as an impaired glucose levels or tolerance and increased insulin. Now, this is not something that the regular doctors ever check. Like when your blood glucose is, say, in the morning, when you wake up, it's 80, your insulin should be 5. But if your insulin is 22, that's a lot of insulin resistance. So you can pick that up by checking the insulin very early. And then 5 is decreased HDL. This is normally called healthy cholesterol, but it's not always healthy. If it's extremely low or extremely high, we have trouble. But for this condition, which we are talking about, metabolic syndrome, it's low HDL, increased or impaired blood glucose. That means it's higher than normal, like 105 fasting, 110 fasting. 127 fasting 2 times in a row is considered diabetes, or 126. But what is 110? That is pre-diabetes. That's impaired glucose tolerance. And with an increased insulin, puts you at that risk. Increased blood pressure or hypertension, right? Increased triglycerides. If you're a beer drinker or if you eat a lot of carbohydrates, like a South Asian population, India and China and Philippines, all of that, you will have a problem with increased triglycerides. And waist size is all over, like from 94 centimeters to 105 is considered metabolic syndrome, and in women it's greater than 85 centimeters. In Asian women, it's a little lesser. So if this were to come to like 6 inches, we're looking at less than 30 inches for Asian population. I guess they're just built a little differently. They're the skinny fat people. And the sixth one, some of them use it, is the BMI. BMI is body mass index. And usually, if you're not very muscular, the BMI can be used, and usually greater than 25 puts you at a risk for metabolic syndrome, diagnosis of metabolic syndrome in some of the groups. And the last one, just only one group, I can't remember what the group is, but there is a group that considers urinary excretion. That means when they check your dipstick of what is called microalbumin, that's the smallest, the largest protein, if it's filtering through, that if it is greater than 20, you're at a risk for metabolic syndrome. So you can see, if you have any 3 of these 7 criteria, you could potentially be having metabolic syndrome. But the way I see it, if somebody comes to me with urinary excretion of protein, I always worry about what else am I missing. They may have a normal or high normal blood pressure, like they may be 138 or 130/75 in the office, but every time they get stressed, it's actually going up to 140/90. I can pick that up only in a 24-hour blood pressure monitoring. Somebody with high triglycerides, they could be just around 200. But the chances are once they eat a meal, and if I do postprandial, they're going up to 600, 700. So catching these test results to put somebody under that syndrome is actually the hardest part. By the time they come to see a person like me, I can obviously see there's always this waist size, which is a huge part. Like most women are concerned about it because they've been trying to lose weight, but they've been buying bigger and bigger pant sizes. Sometimes the impaired blood glucose, this lasts for years before you become a overt or clinically you get diagnosed with diabetes. Remember, before you get diagnosed with diabetes, you can walk around with this condition for 5 to 7 years. The question is, what do you need to shift to not become a diabetic? And that's what we're going to talk about. In most of our webinars and workshops, that's what we will talk about. So make sure when we release those webinars or workshop, you sign up for it. And then body mass index. A lot of times women after pregnancy do find it difficult to lose the last 10 pounds, but then as the BMI increases, which we technically, if you don't take care of your health, you're not exercising, you're not eating healthy or being consciously aware of what you're eating, and we'll talk about the eating part in another video, but for all practical purposes, if you're gaining 5 pounds a year, then you are increasing your risk for metabolic syndrome. So I just want everybody to understand metabolic syndrome. Any 3 of these, right? Any 3 of these, 1, 2, and 3, I see. Or it could be blood pressure, blood sugar, and low HDL. That could be the 3. It could be any 3 of these will define you as having metabolic syndrome. Hopefully this is useful if you've been struggling to understand, what do I have? Is it just blood sugars? You may not even have impaired blood glucose, but nobody's checking your insulin to see that's the first sign that you're having impaired blood glucose. You may just have slightly increased triglycerides, slightly increased weight, and maybe a slightly increased blood pressure. Still, you are considered metabolic syndrome if you go to a functional medical doctor. Okay, so don't wait till a disease manifests itself. When you are being told that something has shifted, it's the time to take action and shift back to optimizing your health. So stay tuned, and we will put out several other videos for you, and of course our webinars as well as workshops. The workshops will be paid, but the webinars will be free. Whatever suits you, go ahead and click on the links to join them. Take care.